All right, let's get right into it. This is your high-yield, last-minute revision guide for the Neurology OSCE. We're going to cut through all the noise and give you exactly what you need to absolutely nail the higher brain function station. Let's do this.
Yeah, we know. The clock is ticking, the pressure is on, and you're feeling it. You just need a clear, solid game plan to get you through. Well, that's exactly what this explainer is for, to give you the frameworks and the must-know facts that are going to make you stand out.
Okay, first things first, let's talk about the gold standard. This is the full, complete, ideal way to examine higher brain functions. Why is this important? Because mastering this structure shows the examiner, right from the get-go, that you have a logical and professional method.
And here's that flow. Look at how logical this is. You start with the absolute baseline, consciousness. From there, you just move systematically through orientation, memory, and attention. After that, you get into the more complex stuff, right? Language, praxis, and executive function. And, so crucially, you always bookend the whole thing. Introduce yourself at the start, and thank the patient, and summarize your findings at the end. That is the complete professional package. But what happens when that examiner turns to you and says, "You have 5 minutes"? Yeah, that's when you need a shortcut. Now, this isn't about skipping important steps. It's about being incredibly efficient and hitting the highest yield areas when you're really up against the clock. So here's the trick. You're going to target these 5 key domains. You start with orientation, super quick. Then a 3-word recall for memory. You hit them with serial 7s for attention, naming a couple of common objects for language, and you finish with repetition, which tests the arcuate fasciculus. You see? This sequence just brilliantly shows your ability to rapidly screen the most critical cortical functions. It's a lifesaver.
All right, you've done the hands-on exam. Now it's time for the Viva. The questions are going to come at you fast, and you need concise, spot-on answers. So let's run through some absolute classics that you just have to have ready to go.
First question, why is Broca aphasia non-fluent?
The answer? It's a motor speech planning area lesion. Simple. The patient knows exactly what they want to say, but the part of the brain that coordinates the muscles for speech is damaged. That's it. It's short, it's sweet, and it's exactly what they are looking for.
Okay, next one. Why does damage to the hippocampus specifically cause recent memory loss? Because of a consolidation defect. That's the key phrase. The hippocampus is failing to turn those short-term memories into long-term ones. Simple as that. And another classic you're almost guaranteed to see. Why does a frontal lobe lesion change someone's personality? Come on, you know this. Think about what the frontal lobe actually does. It's because it is the executive control and inhibition center. When that's damaged, the brain's filter is just gone. And that's what leads to all those classic personality changes you hear about.
Now for a super common comparison, delirium versus dementia. You've got to know the difference. For delirium, remember these 3 things. It's acute, it's fluctuating, and attention is impaired. For dementia, think it's chronic and memory is the predominant problem. Getting these distinctions straight is absolutely vital.
Okay, seriously. If you remember only one thing from this entire explainer, make it this next slide. This is your ultimate cheat sheet. It's the slide that links the function to the brain structure to the bedside test. This is pure gold for your final revision.
Let's break this down, because you have to see how it all connects. For function, consciousness, the structure is the brainstem and cortex, and your test is the GCS. For memory, the key structure is the hippocampus, tested with a 3-word recall. For language, you're looking at the dominant hemisphere, and you test that with naming and repetition. For executive function, you need to think frontal lobe, and you test it with abstract thinking. And finally, for recognition, you're assessing the parietal lobe with object identification. You need to commit this table to memory. This is your map for localizing any higher function problem you find.
Because at the end of the day, that's what neurology is all about, right? Connecting the symptom to the structure. After this, you have the frameworks and you have the key facts. So, are you ready to go in there, localize the lesion, and absolutely ace this exam? You've got this.